jury, at the beginning of today's trial, my co-counsel, Mr. Ben Hepner, asked you to think about painting by numbers. Because at the end of the plaintiff's case today, all they left you with was a blank page full of numbers. That's why we, the defense, have come here today to fill in each of those numbers with a color, to bring you the full picture. Because numbers don't paint the full picture. Now, throughout today's trial, you've heard numbers being referenced to constantly. Reese Lansing's age, his blood test results, and all the numbers and figures that went into calculating monetary damages. But all those things are just that, numbers. And they don't paint the full picture. Now, you've met Reese Lansing. He's a 16-year-old. But age is just a number. Because when on the dates surrounding the surgery, what the hospital encountered wasn't a number, but a person, Reese Lansing. Someone who is mature and presents themselves in a respectful manner. Someone who is knowledgeable about the medical field and extremely intelligent. Someone who is about to graduate top of their class at the university. And someone who has already been offered a spot at the most prestigious medical school in this country, Stanford. That's the Reese Lansing the hospital experienced, and that's the Reese Lansing you met today. Now, why was Reese Lansing at the hospital? It wasn't because he was sick or because he needed treatment. And he wasn't picking up medication. No, Reese Lansing was at the hospital because he was saving his best friend's life by donating his kidney. Reese is a healthy individual going to the hospital to perform one of the most selfless acts of donating an organ. Now, how do we know that Reese is a healthy individual? Well, because on his most recent blood test results, all of his levels were within normal ranges and his kidney was functioning normally. The plaintiff's expert can only point to two numbers throughout Reese's lifetime of blood tests that show any abnormalities. And these numbers don't paint the full picture. Because these test results were found in 2011, when Reese was merely months into college, and with a heavy burden of pre-med classes and adjusting to a new lifestyle, having to manage his own money, find his own food, and living in a dorm full of other students much older than him, college would be stressful on anyone, especially a 13-year-old. Now, the plaintiff wants to paint a picture of Reese as a naive child, incapable of making decisions and struggling with PKD. But to prove this, all they have shown you are these 2011 blood test results where his cholesterol levels and GFR levels were slightly higher than normal. But the numbers don't paint the full picture, because in 2011, Reese was not struggling. In fact, Reese may never struggle from kidney disease. And now, 3 years later, in 2014, Reese's blood test results didn't get worse. They got better. And Reese is as healthy as he was back in 2011. Now, as we mentioned, there have been several numbers talked about informing monetary damages. And the first of these are the actual damages of today's case. This includes future medical expenses, lost wages, and pain and suffering. And the plaintiff had the burden of proving you these elements today. They had the obligation of proving these elements today, these damages today, by a reasonable probability, a probability sufficient to undermine confidence in the outcome. It wasn't good enough for the plaintiff to come up here and stand before you and tell you what Reese needs, but they had to provide you compelling evidence. They had to paint the full picture. But let's talk about what they actually brought to you today. Their first witness was Harry Lansing, the parent of Reese Lansing. And you heard that Harry treats Reese like a normal college student. He allows him to live outside of the parental home. He allows him to manage his money on a day-to-day basis, live in dorms with kids much older, and having to find food on his own. In all aspects of Reese's life, Reese's parents allow him to live a normal life of a much older child, of a much older person. However, one thing that the parents of Reese Lansing did withhold from him was vital medical information. Because while Reese's parents were treating him like a normal college student, they never told Reese of his genetic mutation of PKD. Why didn't they tell him this? Well, Harry Lansing is not Reese's biological parent, and Reese wouldn't know about his biological medical information because his adoptive parents failed to tell him this. But the truth is that Reese's biological family all are carriers of PKD. And while the plaintiff wants to focus you in on Reese's biological mother, who did suffer from PKD, they'll ignore the fact and not paint the whole picture of her lifestyle. A lifestyle of excessive alcohol consumption, smoking, showing up to the doctor's office passed out, and not listening to doctor's orders. A deadly combination for anyone with or without PKD. However, the rest of Reese Lansing's biological family also are carriers of this gene. And members of the jury, they are living happy, fulfilling lives well past the age of 35. In fact, Reese's grandfather is approaching age 74 with PKD. And not once has he been slowed down or stopped by this disease. Now, we heard from Dr. Skinner, and Dr. Skinner would like to tell you that Reese is diagnosed with kidney disease, but members of the jury, the truth is Reese is simply a carrier of a genetic mutation, PKD. He is not symptomatic, he does not need medication, and he is not on treatment. And Dr. Skinner's only basis that Reese will ever become symptomatic are those two numbers in 2011. These numbers don't paint the full picture. Now, we also heard that the life care plan Dr. Skinner presented to you today would be the same life care plan Dr. Skinner would have presented prior to the surgery ever occurring. What does this mean, members of the jury? It means that this unauthorized surgery was not the reason for any of these future medical expenses. Because with 2 kidneys or 1, Dr. Skinner's life care plan is the same for someone who becomes symptomatic with PKD. The surgery did not cause Reese to become symptomatic with PKD. Now, we also brought an expert in today's case, Dr. Sabbath. And against Dr. Sabbath's conclusion, he was kind enough to walk us through Dr. Skinner's life care plan and showed you that there are several discrepancies in the numbers. But ultimately, members of the jury, all these numbers are purely speculative. In fact, Reese may never become symptomatic of PKD, and if he never becomes symptomatic, he will never need dialysis, he will never need dialysis port surgery, a kidney, anti-rejection medication, a nurse, and he will never have any lost wages because he may never suffer from PKD. Now finally, you heard from Reese himself, and he came up here on the stand today, a healthy 16-year-old about to graduate from college, and he told you he's not in pain. He's not suffering. He doesn't need medication, and he doesn't need treatment. And ultimately, members of the jury, he told you he does not need and he does not want any money from this trial. Now, additionally, the plaintiff has brought exemplary damages, and these are damages used to make an example of or punish the hospital, Alastair City Charity Hospital. The plaintiff wants you to think that the hospital's actions were so reckless, so purposeful, that they need to be punished with dollars and cents. However, in order to do this, you will need to consider more than numbers. You will need to look at the full picture and see exactly how the hospital acted. So let's talk about this. Reese approached Alastair City Charity Hospital to donate his kidney. Reese was not coerced or tricked. In fact, he was admired for his selfless act. The hospital informed Reese of everything he would need to know: the risk, the process, the recovery involved in the surgery, and Reese believed that what the hospital told him was true. In response, Reese had to inform the hospital of his age and medical history. And the hospital believed that what Reese had told them was true. But was it? Members of the jury, you heard from Reese today that when asked if he was complete and accurate on his paperwork, he said yes. But when we dove a little further, we realized that a month and a day is not a full birth date. In fact, Reese told you that he knew what it would mean if he put his birth year on that form, because Reese is a minor and he wouldn't be able to donate his kidney. And Reese told you that he was willing to do anything, even if it meant lying, in order to save his best friend's life. Now, Reese is someone who is also looking to become a part of our medical field, and he acknowledges that the information a patient tells you is something you rely upon to treat them further. So when Reese wasn't able to inform the hospital about his PKD, the hospital wasn't able to react. The hospital was faced with the opportunity to save a person's life, and they trusted that the person to do this was being honest with them. And when faced with a life or death situation, members of the jury, can you blame the hospital for choosing life? Members of the jury, you heard that the only flaw in this surgery today was the fact that it was an unauthorized surgery based on a minor's age, based on a simple number. The surgery itself was performed successfully, and a life was saved, and no one was harmed. Members of the jury, I'm going to boil this case down to two simple battles: a battle between parents and their child, and a battle between two experts. And let's take those one by one. Now, the parents in today's case, Harry and Leona Lansing, knew about the surgery, but did nothing about it. They never contacted the hospital. They never reached out to Taylor, the recipient of Reese's kidney. They never contacted the police or the school. The Lansings knew the surgery was going on and did nothing about it. They were present at the time of the surgery, but members of the jury, they're present in the courtroom today. Because immediately following the surgery, the Lansings filed suit against the hospital. And just like Reese wasn't able to give consent to the surgery, Reese isn't able to collect on the damages in today's case. No, members of the jury, that will go to Harry and Leona Lansing. The damages you award in today's case will not go to Reese. They will go to the parents who were absent on the day of the surgery, but very much present in the courtroom here today. Now, the second battle comes between the two doctors in today's case, Dr. Sabbath and Dr. Skinner. And the plaintiff's doctor's whole report is based on assumptions. Mere assumptions. These assumptions add up to reach a total of well over $2 million. Dr. Skinner's report that are based on assumptions and two numbers in 2011 total an amount of $2 million. And you heard from Dr. Sabbath that this total is well exaggerated. In fact, he agrees that this is the medical plan for someone who becomes symptomatic with PKD. But this was the medical plan before the surgery, and this is the same medical care plan after the surgery. Because one kid in year 2, the surgery Reese encountered did not make him any more likely to become symptomatic of PKD. I want to remind you at this time, members of the jury, that yes, while Alcester City Hospital has been found liable for performing an unauthorized surgery, this does not automatically guarantee damages. Excuse me, back up. Now, members of the jury, this courtroom is not the proper location to solve a family dispute, and this courtroom is not the proper location to become fortune tellers. The foundation of this court rests on solid facts and logical reasoning, and the plaintiff has brought you neither today. Now, members of the jury, before I leave you, I want to remind you that just because Alcester City Charity Hospital has been found liable in today's case does not mean that you must grant damages. In fact, we would encourage that you find no damages in today's case, because the numbers don't paint the full story. We ask that you consider the full picture, because the amount that you award in today's case will ultimately reflect that full picture. Therefore, we ask that you award the amount of 0 for damages.